Okay, welcome everybody. My name is Marty Mascari. I am a contractor under the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. Both of these programs are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth area. We welcome you all. We're going to be, we have our partners, some of the people I work with at the COG or with the Area Agency on Aging. We have Melinda Gardner and Felicia Warner. And then we have Angel Hanzik. Is that right, Angel?
Angel Hanzik. Yeah,
Hanzik, very good. I don't know why, but I hesitate every time. I just want to make sure. Yes,
it's different. It's different.
No, I just want to make sure I get it. She's here from the Better Business Bureau Education Foundation in Houston, Texas. But before we get started, I want to talk a little bit about the CEUs. For those of you that are joining us for CEUs today, if you could advance the slide one, Melinda, and we'll talk about CEUs. If it will let you. Ooh, there you go. So for those of you joining us today for CEUs, we are offering CEUs for licensed social workers and licensed professional counselors in the state of Texas. Now, if you have a license, a different license in Texas, or you have a license outside of Texas, you're more than welcome to go through the process, get a certificate, and talk to your jurisdiction. But just so you know, there's no guarantees that they'll take it. I've heard a lot of them have, but there's no guarantee. So we're also offering a certificate of attendance. If anybody just needs something to give to their employer or their college or whatever, we offer a certificate of attendance as well. Today, CEUs are worth 1.5 hours of CEUs credits. You must complete the entire live webinar and Q&A to qualify. You must also complete the Google survey evaluation form. This should, as you close out, it should give you the opportunity to open that up and complete that form. But if not, no worry. You will also receive that in a follow-up email that will go out either later today or tomorrow to everyone who is on. Just so you know, if you're on by phone and you're not on a computer at all, you might need to email me your phone number so that I have your name with your full name, phone number, and email address, so I have something to associate with the phone numbers, because the report we get only shows phone number if you're calling in. It doesn't give me any other information to identify you. The Google survey will be up and live, available for a week from tomorrow. And if you'll give me a month after that to get the certificates out, that should be plenty of time, and we should get them out to you. So I'm going to turn it over to Melinda and let her get us started. Introduce Felicia. I cannot hear you. I think you're muted. I don't know. It doesn't show you muted.
Thank you very much, Marty.
There you go.
Thank you for coordinating our Medicare Mondays, and welcome to everyone. And we appreciate you attending, and we would love your feedback as far as other topics that we could present to you, and any feedback on the presentation, on the platform, anything like that, because we do want to provide great service in order for people to learn about these important topics. So thank you all for attending. If you have any questions, feel free to put those in the Q&A. We can keep track of them better versus in the chat. So if you do have any, put those in the Q&A section, and we will try to get to those at the end after both presentations. So today I would like to introduce Felicia Warner. She is a benefits counselor with the Area Agency on Aging, and she started as a volunteer. So she has been with the agency for quite a while and is very versed in Medicare and all its options. So she is going to be presenting today. We had a slight change in our presenters, but she will give you some great information on the SHIP and Medicare preventive services.
Yes.
Felicia, I will advance the slides for you,
Okay.
and you can go ahead.
Okay. This is who we are. My name is Felicia Warner, and we are we're the Area Agency on Aging of North Central Texas, a program of the North Central Texas Council of Government. We're also known as SHIP, which I'll explain later on. And we again partner, as Melinda said, with the Texas Senior Medicare Patrol to provide information on fraud and abuse. So I'm glad that Angel is here today. She has some really good information. So we'll go ahead and get started with the next slide. Oh, I'm sorry. Let me also introduce our other team members, Leslie Kilton, Simon Manrique, and Dolores Purvis. We comprise the benefits counseling team under the direction of Melinda. So we'll go to the next slide. And as you can see from this slide, there are 54 ships in the United States. And there, as you can see, we have had over 2.5 million counseling sessions. And we are even in Puerto Rico, which I want to go to, Guam, DC, and the US Virgin Islands. SHIPs are federally funded. The SHIP program was established by Congress, and their work is funded through the U.S. Administration for Community Living in the U.S. Department of Health and Human Services. And this is how SHIP can assist you. We can help you understand the cost and coverages of which your Medicare, Medicaid, Medigap plans. We can compare options. We just got through December the 7th with open enrollment. And we can help you change plans or enroll in plans. And we can also help you correct billing issues. And since Melinda mentioned that I was a volunteer, I started volunteering in 2009, and I just volunteered, and I absolutely loved it. So here's a little video about volunteering in your community for SHIP.
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer. And I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, the SHIP program may also be known by one of these names.
So sorry. So I encourage anyone who is in our audience today, if you feel a calling for helping individuals in your community, please contact us. We will give you all the information you need to start as a volunteer. It is very rewarding, as the video says. Okay, so how to find your local SHIP. So this is the web page where you can find your local SHIP, and we have a central source of information, expertise, and technical assistance. So we can help with most about everything. So you can just give us a call. And we'll start today on our objectives. This is preventative services for Medicare. And I like to start off by saying, as a benefits counselor, these programs that are offered through Medicare are some of the best that you can ever have. And we know that your health is your greatest asset, and Medicare understands that too. So that's why they have these Medicare preventive services. And this session, we're going to talk about what services are covered, who is eligible to receive them, how much, when preventative services are covered, and how much you pay, and where to get information. So we'll talk about those and keep those in mind, who is eligible and when the services are covered. So preventative services may prevent or detect illness at an early age, and when treatment is likely to work best. Medicare Part B covers preventative services like screenings, exams, yearly wellness visits, lab tests, immunizations to help prevent, find, and manage medical problems. You must have Medicare Part B for Medicare to cover these services. These services are covered whether you get your coverage from original Medicare or a Medicare Advantage plan or another type of Medicare health, Medicare health plan. However, the rules do vary on how much you pay for these services. So it's very important to talk to your doctor about which preventive services you need. And I'll go more into that as we continue with this. So we want you to stay healthy and enjoy your life, because it's very important to us. Paying for preventive services in 2024. If you have original Medicare, you pay nothing for most preventive services. If you get the services from a doctor or other provider who accepts assignment, and I'll go over that, I'll be saying that quite a bit. Assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare, to accept the Medicare approved amount as full payment for the covered services, and not to bill you for any more than the Medicare deductible or coinsurance. If your doctor or other healthcare provider performs additional tests, and please keep that in mind, additional tests or services during the same visit that aren't covered under the preventive benefits, you may have to pay coinsurance and the Part B deductible. So we'll talk again later about this and what are the coinsurances that you might have to pay. So we'll go to the next slide. So paying for your preventative services, if you have Medicare Advantage, your plan cannot change. Charge you for preventive care services. If you see providers that are not in your plan, of course, that's under Medicare Advantage, charges typically apply. But always speak to your provider about your eligibility for each service. And then we'll talk about next what's covered. You see a whole list of those. Just during this session, we don't have time to go through all of them, but I'm going to hit some of the highlights, and we'll explain which preventive services are covered by Medicare. Medicare covers many of those services that can help you stay healthy. Talk to your doctor. I like to say, have that open, honest, frank conversation with your doctor about your health care. And if you need more information, that's on the Medicare website. Welcome to Medicare Preventive Visit, called the Initial Preventive Physical Examination. It's a great way to get up-to-date information on important screenings and vaccines and review your medical history. It's only offered one time within the first 12 months of getting Medicare. Part B. During your preventive visit, your doctor or healthcare provider will perform the following services. And it's important to keep that in mind, that you will again have that open, honest, frank conversation with your doctor about your medical and social history related to your health. They'll do, of course, a blood pressure, height and weight, and a body mass index, and perform simple vision tests and review potential risk factors for depression, review your ability to, your functional ability and your level of safety, which means an assessment of your hearing, the ability to successfully perform activities of daily living, fall risk, and home safety. So there's a number of things you can talk to your doctor on this initial visit, and we encourage all those who are Medicare beneficiaries and their loved ones to have that frank talk. We'll go to the next slide. After you've been on Medicare Part B for longer than 12 months, you can get a yearly wellness visit. And this visit is developed to help update you and a prevention plan just tailored for you. Medicare covers one yearly wellness visit every 12 months, and you don't need to have the you don't need to get the Welcome to Medicare preventive visit before getting this wellness visit. So there's a number of things they'll talk about. Update your health assessment, as you can see on the slide, your medical and family history, which is the most important thing you can talk about, is your medical and family history. Again, check your blood pressure and all the items that are listed on the slide. But I would definitely say to update your medical history, because that's going to be a guide on what preventative services you might be eligible for. So again, have that frank, open, honest conversation with your provider about your healthcare needs. So as I mentioned before, I'm not going to go through all of them. We really don't have a lot of time to do that, but I will just hit some of the major ones. And it's the abdominal and aortic aneurysm screening. And this is an ultrasound for people who are at risk. Of course, you must get a referral from your doctor, but oftentimes it's for a one-time screening of this ultrasound. And if you have a family history, and again, it's important to talk to your doctor about your family history. If you are a man 65 to 75 and have smoked at least 100 cigarettes in your lifetime, this is probably a test for you. If you're a person with Medicare who has other risk factors in the category recommended for screening by the United States Preventive Services Task Force, then that's something you need to talk to your doctor about. And if your doctor, again, takes assignment, there would be no cost to you. So with the next slide. Alcohol misuse screening and counseling. Medicare covers an annual alcohol misuse screening. Various screening tools are available, but Medicare does not identify specific alcohol misuse screening tools to use. That decision is left up to and the discretion of the clinician. So talk to your doctor, have that open, frank, honest conversation about your healthcare needs. And As you can see on the slide, breast cancer is the most frequently diagnosed non-skin cancer in women. It is second only to lung cancer as the leading cause of cancer-related death among women in the United States. And I want to say every woman is at risk, and this risk increases with age. And screening mammogram is a procedure that can help detect that early when you have more likely chances of survival. Medicare covers this annual screening. For women who are 40 and older, Medicare provides coverage for one baseline screening mammogram for women 35 to 39. And often you don't need a doctor's referral, but the x-ray supplier will need to send your test results to the doctor. So you can have your doctor just recommend, give you a referral if you choose to. With original Medicare, there's no cost if the doctor or other qualified health provider accepts assignment. And also diagnostic, if you have had breast cancer, and also with men, if you have had a lump or other sign of breast cancer, then you have a history of breast cancer, and your doctor can have you do a diagnostic breast exam. So we'll go to the next slide. So Medicare covers bone mass measurements, and this is to measure the bone density. These tests can help you and your doctor choose the best way to keep your bones strong and healthy. And that way, osteoporosis, which is a disease in which your bones become weak and more likely to break. And I might add again, it's a silent disease, meaning that you might not know that you have it until you break a bone. So we don't want to get to that. So if this is available to you and after you've talked to your doctor, this test would be right for you. We'll go to the next one. Cardiovascular disease screening. Medicare covers this test, and it's a check for what's your cholesterol and other blood fat, lipid levels. High levels of cholesterol can increase your risk of heart disease and stroke. So you want to have that done as your doctor deems necessary after you've had that open, honest, frank conversation with them about your health. And you can also get more information on the Medicare.gov coverage, cardiovascular disease screenings, and it's available. Go to the next slide. Again, this is cardiovascular disease, behavioral therapy. And Medicare covers this intensive behavioral therapy for cardiovascular disease reduction. So you can, Medicare covers this face-to-face and talk about what behaviors need to be changed, and the counseling is furnished again by a qualified primary care doctor or other primary care practitioner. And so again, I'm just going to keep saying it, have that open, frank, honest conversation with your doctor about your health. And another one I think that is important, cervical and vaginal cancer screenings. Medicare covers PAPS test, and pelvic exams and the clinical breast exams. And this is done once a year. Of course, if you are at high risk, a screening pelvic examination is performed to help detect fibroids, which are benign tumors in women of childbearing age, precancers, genital cancers, and infections, sexually transmitted infections, STIs, other reproductive system abnormalities. And you can, again, talk with your doctor about the cervical and vaginal cancer screenings. And this is continued, and it's covered, again on the slide, once every 24 months or once every 12 months if you're either at high risk. So if you're high risk for cervical or vaginal cancer, based on your, again, your medical history and other findings, then you can have that test done more often. If you're of childbearing age and had an abnormal Pap test in the past 36 months. So high risk factors, again, you talk with your doctor about your high risk for cervical and vaginal cancer. Colorectal cancer screenings, which is a cancer, is the fourth most common cancer in men and women. And if it's caught early, it's often curable. And you'll want to take advantage of those tests. Again, having that open, frank, honest conversation with your healthcare provider about your healthcare. And I say if it helps prevent or find cancer early, let's go do that. And these are some of the tests. As you can see, the screening test, if it's normal risk, it's covered once every year, or if it's high risk, it's covered once a year or every 4 years or every 24 months. And just pay close attention to that. If you are any of that normal risk or high risk, you pay no costs as long as the provider accepts assignment. So I think that's a pretty good deal. And so we'll go to the next slide here. I think that was basically all I wanted to say on that one. Oh, I'm sorry. All people with Medicare 50 and older who aren't at high risk for colorectal cancer are covered for the screenings also. Don't want to forget that. And here also, again, if you are 50 and older and aren't at high risk, these are the tests that you can have. And I believe Marty will make the slides available if you want to go back and view some of that. And we'll move on. Prostate cancer screening. All men have prostates. They need to be checked out. However, the causes of prostate cancer aren't clearly understood, though research and several factors of case, have identified that have been identified that increase your cancer risk, including, again, family history of prostate cancer, men 50 and older, diet of red meat and high-fat dairy, and smoking. Medicare provides coverage for prostate cancer screenings, tests, procedures for early detection of prostate cancer once every 12 months for men with Medicare 50 and older. And I want to also say that when you go and you have your prostate the exam done, of course, they'll draw blood and do the PSA, which will be also, it's also a tool that the doctors use to determine your level, if that is something that affects you. Go to the next slide. These slides are very informative if Marty will make those available. Lung cancer screening. Medicare covers lung cancer screenings with low dose. Well, you know, they do the x-ray, so it's low dose. So it's not any, it's not harmful, but you often do not have signs of lung cancer. And for people who are 55 to 77, and either you're a current smoker or you have quit smoking within the past 15 years, you have a tobacco smoking history, you smoked 30 packs in, you know, a number of years, or if you average a pack a day for 30 years, I'm sorry, uh, you can have this lung cancer screening and you must get a written order from your doctor. And again, they must accept assignment to get that testing done. So again, I guess I'm harping on that. Have that open, frank, honest conversation with your doctor about your risks, especially if you have smoked. And another subject that people generally don't really want to talk about sometimes, but depression screening. Medicare covers an annual screening for depression for people with Medicare in a primary care setting. Of course, that can be in the doctor's
Felicia,
office. So if that's something that, again, you've talked, dialogue box said my internet was unstable. You still hear me?
yeah, we actually lost you for just a bit.
Oh my,
You locked up. If you could go back, just
oh sure.
a couple of
Depression,
sentences.
okay.
Just a couple of sentences.
Depression's, okay. We were on the slide depression screening. So again, I'm just going to keep saying over and over, have that open, honest, frank conversation with your doctor. If this applies to you, they are your best advocate for your health. Okay. Diabetes is a disease in which your blood glucose or sugar levels are too high. Of course, we know glucose comes from the foods you eat, and insulin is a hormone that helps the glucose get into your cells to give them energy. But again, you would have that talk with your doctor. Of course, they would do testing, that little fingerprint prick that they say it doesn't hurt, but it hurts. And have that done, especially if you're 65 or older, you're overweight, you have a family history of diabetes, or you've had diabetes during pregnancy. And of course, always keep in mind, it is no cost if the provider accepts assignment. And flu vaccines. And I know we're in flu season, but flu, again, is a contagious disease caused by the influenza virus that generally occurs during the winter months. And it affects your nose, throat, and lungs. And of course, flu can lead to pneumonia. Several of my family members have ignored the flu, and it has just led to pneumonia. And we encourage, if the flu shot is something that you want to participate in, again, talk to your doctor. And generally, you can get that vaccine. And if necessary, you can get it twice a year. So again, talk to your doctor. And glaucoma. How important is our sight to us? Glaucoma is a group of diseases that damage the eye's optic nerve and can result in vision loss and even blindness. Some forms of glaucoma do not have any symptoms. So you may have the disease even if you don't have any trouble seeing or you feel any pain. So definitely always get your eyes examined. And again, go back to the having that conversation. I know you're tired of hearing about having that open, honest, frank conversation with your doctor about your health status. So we know how important our eyes are. So again, if you have a family history, you have diabetes, you're African American, 50 or older, Hispanic American, 65 and older, Medicare will pay for that testing. Next slide. Hepatitis B shot. And if we all know, hepatitis B is a serious disease caused by the hepatitis B virus. And the virus can affect people of all ages, and hepatitis attacks the liver and can cause chronic or lifelong infection, resulting in cirrhosis, scarring of the liver, liver cancer, liver failure, and even death. Medicare provides coverage for the hepatitis B vaccines, which is a series of shots, and it's recommended for those individuals ESRD, end-stage renal disease, people with hemophilia, diabetes, if you're an institution, individuals who live in the same household as someone with the hepatitis B virus and is a carrier, and also men who have sex with other men and injectable drug users. So again, talk to your doctor, have that open, frank conversation. I know you're going to get tired of me saying that, but have that open, frank, honest conversation with your doctor. And COVID-19 vaccinations and tests. And we're all familiar with that. We all lived through the pandemic. So you get to make that choice if you have original Medicare or if you have a Medicare Advantage plan. You can get the testing done. I believe it's one test without an order from the doctor or other qualified healthcare provider. And we'll go on to the next one. Smoking and tobacco use cessation counseling. This is also something that will help you if you do smoke and you talk to your doctor. And tobacco tobacco use continues to be the leading cause of preventable disease and death in the United States. Smoking can contribute to and worsen heart disease, stroke, lung disease, cancer, diabetes, hypertension, osteoporosis, and aneurysms, cataracts, and we know smoking harms nearly every organ of the body and generally diminishes the health of smokers. Medicare covers counseling to prevent tobacco use for people, for outpatient and hospitalized people with Medicare. So if that's something that you want to talk to your doctor about, please do. Please do have that conversation with your doctor or healthcare provider about you want to stop smoking. So we're almost at the very end. And to find more information, this is the landing page for the Medicare.gov. And this is an important tool to use if you are on Medicare or you care for someone on Medicare, or if you just want to help somebody out, have them create an account. It's beneficial information that you can find at your fingertips 24 hours, 7 days a week. If you have a concern about your Medicare and you want to see what your plan has or original Medicare, you can look there. I find this helpful. If you want to find a drug plan or a health plan, they're all on there, including Medigap. And also, again, I can't stress this one enough, find health care providers. And you can look under, you just type it in. If you're just looking for a geriatric doctor, or you're looking for just a primary care doctor in your area, of course, you need to put in your zip code, and you can do a radius of 5, 10, 25 miles out, or just put your doctor's name in that you want to see, and see if they accept Medicare. And you can also talk to someone 24 hours, 7 days a week. Again, Medicare is open. I believe they only got Thanksgiving off, and they are there 24 hours, 7 days a week. And also, this is a reminder, if you have a Medicare Advantage plan and you want to change, you have until March the 31st to make any changes. So you can still make changes if you're unhappy with your Medicare Advantage plan. And you can give us a call and we can help you with that. So we're at the end. I hope this information has been helpful to you. Again, I'm Felicia with the Area Agency on Aging and SHIP. And there's our number, toll free, the email, and our website and our office hours. It's been great. I appreciate you all so much. And next, I'll have Melinda introduce Angel.
Thank you very much, Felicia. That was great information. And thank
Melinda,
you for
Melinda, oh, having a very hard
Yes.
time here. Go ahead.
Can you
Try
hear me
again.
now?
That's better.
Can you hear me now?
Yes. That's good.
I remember that.
Thank you very much, Felicia. That was great information. And I just love how you pace this, because we do have older adults on the line. And so it's good to be able to take time for them to understand what's being said. So I appreciate that.
Thank you.
Now we will turn it over to Angel with the Better Business Bureau Education Foundation, and she has been promoted to Outreach Manager for the Senior Medicare Patrol. So we are glad to partner with them. And Angel, do you want to control your slides?
Yes, please, if
Okay.
that doesn't cause too much trouble.
All right, if you want to check to see if you can advance it to your first slide. All right, wonderful.
There we go.
And I'll
Okay.
turn off my video and sound.
All right. Well, thank y'all for the introduction. And Miss Felicia, thank you for that wonderful presentation. It is such important information. So thank you again. As they said, my name is Angel Hanzik. I'm the outreach manager for the Texas Senior Medicare Patrol. And today's theme is preventing, detecting, and reporting Medicare fraud. So now you're getting all your Medicare benefits. Now let's make sure that we have access to all of those and we are not being defrauded, and that Medicare is not being defrauded, so we can protect all those benefits. This is for us to have a scam-free year. That's kind of our theme this year, is no scams all year. So we just want to do a little overview of that. So what even is the Texas Senior Medicare Patrol? So we are a federally funded program. And we are specific to Texas, but there is one of us in every single state, as well as the U.S. territories, just as Felicia had mentioned before, the Virgin Islands, Guam, Puerto Rico, and Washington, D.C. So we are truly all-encompassing across the U.S. What we actually do is we recruit and train volunteers and professionals about Medicare fraud and abuse. So we teach them everything that they need to know and send them out into the community so that they can try and spread the word as much as possible, and we can reduce as much Medicare fraud as possible. And then also we are a reporting agency. So if you are experiencing any fraud or abuse, you actually can report that to us. We build a case and then we send it to the correct Medicare fraud control units, because it's not just Medicare that handles Medicare fraud. Fraud is a crime. And so it can go anywhere from local law enforcement all the way up to the FBI. So we send it directly to those contacts there. Our mission here at the Texas Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families, and their caregivers to prevent, detect, report healthcare fraud, error, and abuse through outreach, counseling, and education. Say that 5 times fast, but basically what that is just saying that we educate as many people as we can, and we get out there and we talk about Medicare fraud as much as possible. So what we're going to be going over today is what Medicare fraud actually is. We're going to learn the difference between fraud, error, and abuse. We're going to look at some different scams that are happening this year. And we're also going to provide the skills that you need to prevent, detect, and report that fraud. So I want y'all to go ahead, open up your chat function, and I want you to take a guess of how much money is lost in 1 year to Medicare fraud. How much money is being taken out of the Medicare system on average from scams, from defrauding it, from abusing it. We have someone saying 2 million in the chat. All right, I'll let you know right now, it is much, much higher. In fact, change that million to a billion, and then we'll be a little bit closer. 28 billion. Now we're looking a little bit better, a little closer. 28 billion is still only half of what we're looking at. The estimation is actually that it is $60 billion every single year on average that is lost to Medicare fraud, errors, and abuse. So that wow is correct. Like 6 different wows in the chat. Wow is correct. It is a ton of money that is being lost. Yes, exactly, Melinda. That is just what's reported. It's just an estimation. There's no way for us to actually know how much money is being lost, because a lot of times folks don't know that their Medicare is being misused. There's also about 250,000 Medicare beneficiaries who have had their medical identity compromised. So their number is being stolen and being misused by these scammers. Okay, so why do I care, right? That's not my $60 billion. They can do whatever they want with it. But actually, at the end of the day, it is our money. It is our $60 billion, even though we can't cash it in at the bank. Medicare is federally funded. So that is our taxpayer dollars that are being lost. So just picture taking money out of your wallet and just throwing it on the streets. That's practically what's happening with all this money that's being lost. And then also puts the Medicare trust fund at risk. Obviously, that creates a pretty unstable system if we're losing $60 billion a year. Of course, Medicare is a multi-trillion-dollar program to cover all of our Americans, but it is a lot of money that is coming out of the system. And so we want to reduce that as much as possible so that it is still around for generations to come, so that everyone can benefit from a system like this. But of course, the people who are impacted the most by all of this Medicare fraud is Medicare beneficiaries. So all that money lost actually becomes higher premiums. So now our Medicare beneficiaries have to pay more out of their pockets every month to make up for that loss. There's also less money in the system for these needed benefits. And so our benefits are changing pretty often. You know, we want to look at that every year. And that's money coming out of Medicare that could be used for treating those beneficiaries. And then, of course, fraud impacts our quality of treatment. If our provider or healthcare provider is willing to defraud us and defraud Medicare, that is not a provider I would trust with my healthcare. And so these are all some factors that we need to take into account. Oops. See if I can get back. I lost my thing. Here we go. Okay. So some consequences of this fraud, error, and abuse, besides that $60 billion being lost, right, is medical identity theft. Our medical identity is being stolen whenever someone is taking our Medicare number and using it to obtain payments or services in our name. That's what's happening. So just like our regular identity can be stolen, like our Social Security number, our medical identity can be stolen as well. And this can have a direct impact on our health. If someone is using your medical identity, they are going to the doctor and they're getting benefits in your name. So they're going and getting those preventative screenings, but they're claiming to be you. Now you're no longer eligible for that screening, right? And so this can obviously have a negative impact on our health because, oh, if that's not covered, I'm not going to go get it. Right? If it's not free, it now creates a little bit more of a hardship on us. And that's where personal financial losses come into play. Now we have to pay out of pocket for services that should be covered, that we should be provided. Also, if they are charging your Medicare or using your Medicare number and purchasing insane amounts of equipment for it, and saying that you are getting all of this equipment and Medicare only covers a partial bit, then maybe you'll be charged the rest of it. So if they say that they are receiving X amount of equipment, let's say $60,000 worth of equipment, Medicare only covers 50% of it. And so now that other $30,000 now falls on your doorstep. Of course, this is a pretty extreme example, but it's just to show that this is some of the consequences, the direct impact that it can have on us as individuals, not just as our taxpayer money, right? And so what even is the difference between this fraud, error, and abuse? What is fraud? So let's start with errors. So these are exactly what they sound like. These are mistakes. At the end of the day, we are people, right? And so we are people. And so at the end of the day, I could be typing something into my computer. I'm doing a billing code and I just accidentally type one number twice, or I hit the incorrect number. This does cause money to be lost from the Medicare system because you're being charged incorrectly or it's being coded incorrectly into the Medicare system, but it's an accident. Abuse is whenever these errors become repetitive. So every single time I code this in, I'm typing the wrong number. It's what I think is the correct one. And so once again, it's not intentional, but it is abusing the system because now we're doing it over and over and over again. So even if it's just, let's say, a $5 difference, if I am now doing that coding for 500 people, times $5, I mean, that adds up really quickly. Okay, so that's when we're abusing the system. Now, fraud instead is the intentional misuse of information. So I'm intentionally coding that wrong so that we can get a bigger payout from this service. Or intentionally claiming I'm Felicia Warner and I'm using her information to obtain services or payments instead of her. Obviously, I know I'm not Miss Felicia. And so this is intentional misuse of information, and this assumes criminal intent. So this is whenever we can actually charge somebody for it in the eyes of the law. So now let's do a quick overview of Medicare. Obviously, Felicia and Melinda are the Medicare experts over here, not me. Don't ask me anything about your benefits. But this is just a quick little breakdown of Medicare. So whenever we're talking in terms of Medicare, we're looking at A, B, C, and D. So whenever we're looking at Part A and B, that's typically our original or traditional Medicare. This is what's pretty commonly thought of whenever you're thinking of Medicare. And it's broken down into hospital insurance and medical insurance. And there's also Medigap insurance or supplemental insurance that fills those holes in coverage. Or you could also use a Part C plan, the Medicare Advantage plans, you know, those private insurance companies that provide plans to Medicare beneficiaries. Or there's Part D, just prescription drugs. So this covers your prescription drug costs. It's an additional plan to assist you with covering the cost of your prescriptions. And so already this is a lot, right? There's so many different parts. There's so many different Medicare Advantage plans. There's so many different doctors you can go to, so many different benefits you have to look at, which is exactly why we have Miss Felicia and Miss Melinda to walk us through all of that confusion. But that's also why scammers target Medicare. It is a complex system. And so they just hope and pray that nobody's going to look too hard at it, that they're going to look at it and be like, oh my gosh, there's so much information. I'm not even going to worry about it. And so they're hoping that you just let all that fraud just slide right underneath your nose. While they're sitting down and studying and figuring everything out so that they can know how to best manipulate the system. So, of course, all Medicare beneficiaries are issued a Medicare card, like pictured below, and a number upon enrollment. So everybody has one. It's unique to the individual. But did you know that this Medicare number is as valuable to an identity thief as a credit card? That is right. They want your Medicare number as much as they want your credit card because they can get money from it. So go ahead, open up your chats again. And I want you to guess how much one Medicare number can get a scammer in 1 year. And it's nothing crazy. It's not in the millions or billions or trillions this time. But from one Medicare number, how much do you think? 100,000, 30,000, okay, 10,000. These are some good guesses. These are some good guesses, yeah. So it is actually exactly 30,000. Great job. Who was that? Miss Rachel Foster, good job. Yes, it is $30,000 for one Medicare number. Now, obviously, this number is not as jarring as that $60 billion, but I want you to sit and think, when is the last time you got $30,000 from your health insurance? Never. That's not happening, right? But that is exactly never, ever. But that is how much a scammer can get from a payout from using your Medicare number fraudulently and claiming to be a healthcare provider and actually receiving money from Medicare, claiming that you receive services from them. So this is identity theft, like we spoke about earlier. So we know about how identity theft can look with our social security numbers, right? And so a scammer can file for unemployment in your name or take out loans or open credit cards, getting direct money that way, or file taxes. How it works with a stolen Medicare number is they actually submit false claims. Okay, so like I said, saying that you're receiving a service from them whenever they're not actually a doctor, you never visited them and they're getting a payout. Or you'll start getting supplies that you didn't order, right? So they're charging you saying that you ordered this walker or a wheelchair or diabetic equipment was really, really big last year. So they're getting money, a big payout from that, and you're getting useless supplies that you don't need. And you'll start seeing that error, fraud, and abuse on your Medicare summary notices. That is one great thing about Medicare fraud is we can track it. The only way that they're getting a payout from Medicare is if it shows up on your Medicare summary notice because they're using your number. They send it in, Medicare sends them a payout, and now it goes on your Medicare summary notice. So that's why we want to be reading our Medicare summary notices. And I'll get into that a little bit later. So first, let's look at some technology that scammers are using nowadays. So first we have dialers. So that's basically them using a software machine to just call a list of numbers. So imagine they have a list in front of them and it automatically calls one after another, after another, after a number. So they don't have to do that hard work of typing in someone's phone number every time. A phone bank is whenever it is a group of people now using those dialers. So we have a whole room full of people. Imagine like a call center, right? And they're all just scammers working together, calling through as many folks as they can. And they're reaching out to hundreds or thousands of folks in a day. Robocalls is whenever they don't even want to do the hard work of putting that together. They don't want to have to talk to anybody. And so it's actually a computer talking to you. So a few years back, I remember it was the phone calls, we would all get them saying, we're calling about your car's extended warranty. And yes, that was a huge one. And that's a great example of a robocall. Spoofing, I'll jump into a little bit more in just a moment, but malware is also really huge. So malware, that's just like a fancy little tech word to say viruses on our computers and our devices. So whenever we get that email or that text message and it has a link in it and it wants us to click on it or download it and open it up, typically what it is a virus or malware that's going to download onto your device, your phone, your computer, your iPad, your Kindle, whatever you're using, and it'll start tracking your keystrokes. It'll start looking through your passwords and getting your information that way. And of course, social media is a huge tool for scammers. So it's all over Facebook, okay? All sorts of different ads or false products or fake websites where you'll go. It looks like it's some amazing deal. You want to shop here. It's got a 50% discount. And then you put your payment information in and it's completely unsecure. And now they have access to your financial information. So we want to be careful whenever we're on social media and we see those too good to be true discount deals. Okay, so now let's jump into spoofing. So spoofing is whenever Medicare calls you. So quick tip, Medicare is not going to call you. That is not happening. If someone is calling you and they claim to be from Medicare, they say, hey, this is Medicare. We just wanted you to confirm your Medicare number for us. You know it's a scam, 100%. One, Medicare already knows your Medicare number. They don't need to ask you for it. And they are not doing calls like that. They're not calling beneficiaries. The only way they're reaching out to beneficiaries is by mail. And also through email. And I think that's just on a case-by-case basis. It's very rare. And if you sign up for those emails. But spoofing is whenever a scammer is using a software to manipulate the caller ID on your phone. So it actually changes the number that their phone number comes up as. So I'm from out in the sticks. I'm from small town Texas, and my area code is 979. So I live in Houston. A lot of folks maybe don't recognize a 979 area code. So to make it look more local, or to make you more likely to answer the phone, maybe I would use a software to change my number to look like a 713 number, which is a Houston area code, so that you think, oh, it's my doctor, it's my friend from church, it's my neighbor I gave my number to, you know, and they're more likely to answer the phone. It creates some sort of false sense of credibility. So please beware, even if it shows up on your phone as 1-800 Medicare, please do not answer. Just let it go straight to voicemail. Any number that is not saved in your contacts, just go ahead, let it go straight to voicemail. Because real people will leave you a voicemail. I'll say, hey, it's Angel. So sorry, give me a call back. And scammers are not going to do that. And if they do, that callback number is going to be different than what they called you on. Right? Because if you call 1-800 Medicare, you'll get 1-800 Medicare. And that's not where they want you to call. They want you to call them. Also, did you know that all of this information is public record? It is on the internet, your criminal records, any property you own, the vehicles you have registered in your name, if you're married, your phone number, your emails, your addresses, they are all online. Even if you have never posted it, you're not on Facebook, you don't share your information like that, it is public record. And so it is very, very easy to access. I saw a question in the chat saying, how do they get our phone numbers? And that's how, it's on the internet. Our numbers, unfortunately, are not protected in that way. And so scammers are able to access literally any number that is registered in the United States. And this is also to say, if someone calls you or they are speaking to you and they know your address, they say, oh, hey, you know, are you still living at 123, grow lane? Are you still driving that, 1998 Cadillac, whatever? That does not mean that they are legitimate. That does not mean that they are actually the IRS calling and, verifying information. What it is they just Googled it and now they have built a case for you and they're trying to build your trust. So don't trust someone just because they know personal information about you. Okay, now we're going to do a quick overview of some of the Medicare scams that we're seeing here in the state of Texas. But I know that we have a bunch of folks from other states. And so I'm absolutely positive that this is something that is affecting states across the United States. These are just the biggest ones we see here. And the first one is Medicare card scams. So I've touched on this a little bit, but this is whenever someone will call you and request that you confirm your Medicare number. They'll say, hey, this is Medicare. We're sending out new cards soon, and we just need you to confirm your Medicare number so that we know that we put the right one on your card. That is such a waste of resources. Medicare would never do that, calling beneficiaries individually. Like I said before, Medicare knows your number already. And if they were doing a mass resending of cards, there would be public notices about it. You would get a letter, you would get an email, it'd probably be on the news. And so it's not something that is special just for Angel. I get a phone call from Medicare. So this is something to look out for. Or they'll call and they'll threaten to cancel your health benefits if you don't share your Medicare number over the phone. They may claim to be from Medicare or from your Medicare Advantage plan, or even from a healthcare provider and say, well, your number was wrong on our account. You need to confirm your Medicare number with us now, or you won't get any more health benefits. We're going to cancel it. You'll have nothing else for the rest of the year. You'll have to pay so much money. That is not how they operate. That is not how Medicare operates. That's not how the healthcare system operates. They're never going to ask you to share your number over the phone, and they're definitely not going to threaten you. Oops. Another one that we are seeing is genetic testing fraud. So a genetic test, this is a real thing, and it it is where you can actually be swabbed and your DNA is tested to see if you are genetically predisposed for cancer, cardiovascular disease, kidney disease, all sorts of things, right? It's a really wonderful comprehensive list, but it is a multi-$1,000 test and it is only available to less than, I think, 3% of Medicare beneficiaries. So it's very, very rare. It has to be recommended by your doctor. Your doctor has to say, I think you need this. Let's go ahead and do some genetic testing. So if you are at a health fair or you get a phone call, someone comes up to you and says, hey, this is totally free. This genetic testing is totally free for all Medicare beneficiaries. Go ahead, share your Medicare number. Here's a cotton swab, swab your cheek. We'll send it off. We'll get those results to you. What's going to happen is they are going to send it to Medicare. They're going to get a multi-$1,000 payout and you're going to get no information. Instead, you just shared your genetic information with a scammer. Or Medicare is going to say, hey, no, they are not eligible for that. Angel is not eligible for this genetic test. We are not going to cover it. And so now they're going to send that bill to you. Now Angel has to pay thousands of dollars for a test that I'm not even going to get results for. So please watch out for this. Anyone who is contacting you saying that you should do this test, you have this great benefit, double check with your insurance and also make sure it is recommended by your doctor first. Okay, durable medical equipment fraud. So durable medical equipment is any sort of medical gear that can be reused multiple times. So something like gauze is not durable medical equipment, but something like monitors or a wheelchair, this is durable medical equipment because it's meant to be used multiple times. Because things are meant to be used multiple times, they're typically more expensive. They cost more, and that's why we see more fraud with it, right? Because you get a higher payout. These scammers get a higher payout from selling just one wheelchair, let's say. So just make sure that your doctor has assessed your condition and has told you, I recommend that you get this equipment before you are ordering anything. Okay. Don't ever sign any blank forms for anyone. If someone says, oh, don't worry, we'll fill this out for you later, just sign at the bottom. No, absolutely do not do that. You want to know what you're signing for. Also be checking your Medicare summary notices to see if you're getting charged for any equipment that you didn't order or you don't need, or that was not prescribed to you by your doctor. Also, if you are receiving equipment like this in the mail that you never ordered, make sure you send it directly back. You do not want this. Do not pay for it to be sent back. And call the Texas Senior Medicare Patrol so that we can help you get that sent where it needs to go, because you don't want to keep possessing medical items that you don't need that is being charged to your Medicare summary notice. Because if you're keeping it, if you're keeping those items, then it has to stay on your Medicare summary notice, right? It stays on your Medicare because you're keeping those supplies, even if you don't need them and you're not going to utilize them. Okay, home health care scams. Okay, so this can happen whenever you are seeing charges on your Medicare summary notice for services that you're receiving in your home whenever you do not meet Medicare's definition of homebound. Okay, so there are certain stipulations that apply to this. And so you have to ensure that your doctor is actually deeming these services as medically necessary, that you need home health care in your home to be provided to you. So please watch out for this. And also be reading your Medicare summary notices and seeing if you're being charged for services that you do not need or were not prescribed to you by your doctor. Or if you're being charged for things like therapy services that were never provided to you, or being charged for more time than you actually received. So if someone is coming in and doing 30 minutes of physical therapy, but is charging you for 2 hours of physical therapy, that one is a very, very common scam, or a very common fraud that we see. Ambulance fraud is actually pretty common, surprisingly. But ambulances are expensive, right? And so anything that costs big money, we are going to see fraud there. So that actually occurs whenever ambulances are being used whenever they're not actually medically necessary. So if you could have been transported in a wheelchair van instead, or if you're being charged for more miles than you were actually traveled with. So if you're 5 miles from the hospital, you took an ambulance and you got charged for 50 miles, this could be fraud. Okay. Or if you're being billed for an emergency trip whenever it was not an emergency trip. Of course, this costs more, we're using more resources. Or billing a ride that was actually in a taxi or a wheelchair van as an emergency transport. So we had a pretty big case a few years ago where a woman would, she stayed at an assisted living center and she would get picked up and taken in a wheelchair van to the community center once a week to go play bingo. And come to find out months later, she was being charged once a week for an ambulance ride to and from the community center. She was being charged for 2 ambulance rides per week for months, which adds up very, very quickly. So there was a lot of money that was being wasted from the Medicare system from that. Okay. So watch out for this as well if you or a loved one have taken an ambulance. Unfortunately, we also see hospice fraud. With hospice, we have to ensure that your doctor has certified that you are actually terminally ill and expected to live 6 months or less if the disease runs its normal course. So we need to be really wary of hospice services that are offering really good, like too good to be true offers, or offering gifts in return of using their hospice services, or saying, don't worry if your doctor hasn't certified that. It's okay if it actually is 2 years or 3 years that you're expected to live, we can cut you a deal. So anything like that, that should set off red flags and alarms, and we should be wary of that. And we should be contacting our Texas Senior Medicare Patrol. And then also, if you have quality of care issues, if you believe that your family is being mistreated while in hospice care, that's not necessarily fraud, but that does need to be reported to the Beneficiary and Family Centered Quality Improvement Organization, which is listed below. Okay. Nursing home scams are very, very similar to those home health scams. Whenever services are being provided that were not actually prescribed by your doctor, or whenever you're being billed for more therapy or visits than were actually provided to you, or, and this is a big one, being charged for more expensive services than you were actually being provided. We had a case where a doctor would come in and they would offer free pedicures to all the folks in the nursing home. So he'd come maybe once a month, come do free pedicures in exchange for your Medicare number. And come to find out, he was actually charging that as diabetic foot care. He's saying he was coming in providing diabetic foot care to all of these folks in this nursing home whenever it's supposed to be a pedicure. Right. And so that was a pretty extreme case. So please watch out for that. If you or a loved one is in a nursing home, ensure that there is someone still reading their Medicare summary notices and looking at their benefits. Okay. If they are needing assisted care, if they're in hospice, things like that, please ensure that you are looking at their Medicare summary notices. We've even had cases where someone has passed away and their Medicare is still being charged for services. The scammers are still using their Medicare number even after they have passed away and it is being charged to them. So please be looking at those. And this is just a few of the scams that we're seeing. Of course, there are new ones all the time coming up. Anything that is going on in that current time frame, there's going to be a scam for it. Someone is going to be trying to defraud the system in some way or another. So please just watch out. So what are we actually doing to try and stop this fraud, error, and abuse? So we recommend that you prevent, detect, and report healthcare fraud. Okay, prevent, detect, report. So first, of course, the easiest way to combat Medicare fraud is to prevent it from happening in the first place. So we ask that you treat your Medicare card or your Medicare number like you would treat your credit card. I wouldn't share that number with just some random person on the street. So I'm not going to share my Medicare information with some random person giving me a call, right? So please protect that. Also, only share it with your doctor or other trusted Medicare provider. Unfortunately, those folks that are maybe at the health fairs, those are not trusted Medicare providers. You don't know these folks, and so you cannot trust them. And so please just reserve using your Medicare number for whenever you're actually at these healthcare appointments. Don't carry your Medicare card unless you know you're going to need it. You can actually leave that Medicare card at home in a safe place, like we would leave our Social Security cards, and not carry it around with us in our wallets or purses in fear that it's misplaced. We drop it. It's being misused. Okay, so just leave it at home unless you know you're going to go to a healthcare appointment. Also, know that Medicare is never going to call you. They're not going to visit you. They're not going to come knock on your door and come hang out in your house. They are never going to contact you to sell you anything. Also, be careful and cautious of offers of free medical services. If it's being advertised as free, we just want to be wary because nothing is free, right? Someone is always paying for it. Maybe it's at no cost to you, but it definitely is not free to Medicare, right? So please be wary of offers of this. Also, watch out for identity theft, any sort of tactics that you use to protect your identity. Use that for your medical identity as well. And also share this information, pass this on, share it with your loved ones, your family, your friends, your coworkers. Just get that information out there because the more that we know and the more people that are aware, the less Medicare fraud that will happen. Okay, so we've prevented all that we can. Now we are detecting. How do we actually know that Medicare fraud is happening? Where can we see that? Like I mentioned earlier, it's on your Medicare summary notices. So let's review our Medicare summary notices or our explanation of benefits or any other statements for any services that we did not receive. Okay, services we're being charged for but never happened. Any double billing, so being charged multiple times for the same service. Or any services that were provided to you, but were not actually ordered by your doctor. These were not medically necessary. This is not something that was recommended to you. And so we want to look for those on our Medicare summary notices. These are three of the biggest ones. You can actually access your Medicare information at medicare.gov. If you don't like reading your Medicare summary notices, you've thrown it away, you've misplaced it, you're not sure where it is online. You can actually access that at your medicare.gov account. We also encourage you to use a personal healthcare tracker. This is a free resource that the Texas Senior Medicare Patrol provides. And what it is exactly as it sounds. It is a journal for you to take to your healthcare appointments and write down, I saw this doctor at this day for this long, and this is what happened. So whenever we get our statements in the mail, we can go back and say, I'm being charged for this service, but I didn't even see my doctor that day. What is going on? Or it says, I saw this doctor, but I didn't see that doctor. I saw Dr. Jones instead. So it's your own personal journal to cross-reference between your Medicare summary notices. We offer them in multiple languages. They look like this. They're about billfold size. And so if you are interested in having one of these or providing it to your clients, your family members, et cetera, you can just go ahead and contact me and we can get that out to you. And finally, report. If you see something, please say something. That is the only way that we actually know what is going on and are able to stop the fraud that's happening. So first, call your provider. Call up Dr. Jones and say, hey, I see this weird thing. What's going on here? Because it may just be an accident or an error. And the doctor can explain it to you, say, oops, that's our bad. I'll go ahead and fix that. Or they might say, don't worry about it. Medicare already paid for it. Oh, it's supposed to be like that. Don't worry. So now this is sounding a little more fishy, right? So gather all the information and documentation that you can find, your Medicare summary notices, bills, and call the Texas Senior Medicare Patrol. We are toll-free and completely confidential. It's a free service. So we charge nothing for you to access it. And we offer it in multiple languages. So even if you or your client does not speak English, we are able to still assist. Also, it's free. And so everyone should say, oh my gosh, it's a scam. This is a red flag. But no, this is federally funded. So it is already paid for by our taxpayer money. Thank you, taxes. And so if you're interested in sharing this information in your community, we do take volunteers. We are volunteer based. We'd love for you to join our volunteer team. You can find out more by emailing Cherie Story, our volunteer coordinator, and her email is listed here. And you're also welcome to contact me. Once again, I'm Angel, I'm the outreach manager here. This is my direct line as well as my email and the hotline number. So you are completely able to reach out to us at any time and we can get you wherever you need to go or answer whatever questions you have. And that is all from me, just barely under the time limit. So I will go ahead and hand it back over to our wonderful hosts.
Melinda, were you going to look at the questions? And while you do that, let me, since we're 2 minutes away, can I go ahead and have you advance a slide? I'm going to go through the CEUs while you guys are looking for when we're back. Okay. For those of you joining us for CEUs today, we are providing complimentary CEUs for social workers and licensed professional counselors in the state of Texas. Please note, if you have another license in Texas or a license outside of Texas, you're more than welcome to go through the process, get a certificate, and submit it. But please know there's no guarantee whether they'll take it or not. Although I've had people that have told me they're stuck it, and I don't get involved in that too much because we're not set up with them. But I have had people tell me they've taken it. We're also offering a complimentary certificate of attendance if you need that for work or school or whatever. Today's webinar is worth 1.5 hours of CEU credits. You must have completed the entire live webinar and the Q&A up till the time that has expired, which is about to do that. That we set the ending time for. You must complete the Google survey evaluation survey in order to qualify for any kind of certificate. That should pop up as you're logging out today, or something should pop up that says ask you to go there. If not, you will receive that link in a follow-up email either later today or sometime tomorrow. Please know the Google survey is going to be available to you to complete till 5 p.m. on the 2nd of February, and then give me about 4 weeks after that. Give me till the 2nd of March, if you would, to get those out to you. So let's go advance it one more time, if we could. Oh, there you go. There you go. And just so you know, our next one's coming up very quickly because we had to reschedule this one to later in the month. Our next one will be on our regular date, which is on Thursday, February 8th from 10 a.m. It's not from 10 a.m. to 2:30 p.m. I'm very sorry about that. I guess I need to fix that.
We have a lot of information to go.
That is a lot. It should be 10 to 11:30, I believe. I'll make sure and get that corrected. But you'll see I'm so sorry. You'll see a link in the follow-up.
As long as the date is right. The date and the start time is right.
Okay, that's good. Okay, I'm going to turn over to you for Q&A.
All right. Thank you, Angel. That was a great presentation. Again, just like Felicia, your pace was good, so I do appreciate that. And you brought up some good points. There was one comment about a hospital attempting to charge Gail for surprise bills, and then she called Medicare and realized she was not liable for the hospital bill. And that is one thing that we suggest beneficiaries or caregivers do, is contact your insurance company to see what you owe, because that's who you pay for insurance. And so it's not the pharmacy, it's not the hospital, it is your health insurance. We've had calls from individuals who were billed for hospital visits that Medicare did not cover. Well, they didn't get paid, so then they try to get it from the beneficiary. And if they maybe put in the wrong code, or if it was not medically necessary, or maybe they billed for the wrong thing, then the client or the beneficiary is not responsible for that bill. So always look at that Medicare summary notice to see why it was denied. So that is something to make sure and talk to your insurance about. Okay, so we did that. Okay, somebody says, Faye says, I've been getting a lot of calls lately to my cell phone from many different phone numbers where the person just says, hello, hello, hey, hey. I usually let the unknown calls go to voicemail. Which scam is this? Would you like to answer that, Angel? Oh, are you trying to go back? Oh, you're on mute.
It's the brother-in-law scam. Your brother-in-law's trying to get a hold of you. I'm just kidding. I'm only kidding. Sorry. Angel,
well, there may be.
Okay.
There you go.
Sorry, I was having an issue there. Oh my gosh, I couldn't find the unmute button, but I did respond back to Faye in the chat. But what this is scammers are just trying to get you to respond. This is typically like a recorded line. They recorded saying, hello, hi. They're trying to get you to speak back. Because once you speak back, they know that you are a live line, that you are an active phone number, that there's a person on the other end of that phone that will answer, and they sell your number to other scammers. A live phone number is very, very valuable to scammers. Knowing that someone is going to answer the phone is very, very valuable to scammers, because that's how they get your money, right? Is by speaking to you and getting to actually talk to someone and manipulate them. So that's what that scam is.
Thank you very much. I was trying to get back to the end of the slide so everybody has the information for next month. I don't know how it got to that one. I love those slides.
Loved it so much, we saw it twice.
Right.
Linda, I do see your question about being told by the pharmacy that these medications are a certain price, that Medicare is not going to cover it, and then being called by that pharmacy to say that the medication is going to be now a lower price. I have not heard anything about this specifically. Perhaps someone on our phone lines has heard something, but that is not something that I am familiar with. No. So if you want to email me about that, that would be great.
You know, one of the things,
Right.
I'll bring up an example. I take omeprazole, and one of the things our insurance made us move this year to a different pharmacy, and they were going to charge me $300 and something. I plugged it into GoodRx, which is an app you can download, and I found out I can get the exact same thing without insurance for 20 something bucks at HEB. And so you just really have to watch, and yet the next prescription might be the other way around. I highly recommend GoodRx. It's an app. You download it, and you plug in what the medication is, what's the dosage, and that kind of thing, and it will tell you what all the grocery stores and things are selling it for. The other thing is sometimes it's cheaper to get it to the pharmacy without the insurance than it is with the insurance. As infuriating as that is, you need to ask them, is this the cheapest route? Especially, I do that with anything over 20 bucks. I say, you know, did you find the cheapest?
Good. That's definitely something that we suggest to callers as well. You don't have to go through your Part D plan just because you have it. You can look on GoodRx. GoodRx is not insurance. As Marty said, it's an app, so it's a program that will help you possibly reduce your prescription costs. But you don't have to go through your Part D plan, because if you don't on some of your drugs, that will delay going into the coverage gap or delay having to pay higher costs depending on what GoodRx. And GoodRx is not the only one. There are some others out there. The other thing I was going to mention, there are pharmacies that are in network, there are pharmacies that are preferred, and then there are pharmacies out of network. So the cost could be different for each of those. So that's why it's important to do a plan comparison on Medicare.gov. And you don't have to wait until open enrollment. You can do a plan comparison at any time. That doesn't mean that you can switch plans, but since this is Medicare Advantage Plan open enrollment, if you do have a Part C, which includes a Part D, you can make changes if that's something that you need. So make sure and talk to your insurance company about the cost of your medication as well. So if the insurance is saying your cost is $45, but the pharmacy is saying your cost is $100, check with your plan to make sure that they are giving you the right information. And there should be a handbook, and it should provide the cost of different tiered prescriptions. So tier 1 is going to be this cost, tier 2, this cost, and so on. And so the plan is the one that gives you that information. Thank you for some good questions.
You know, I saw where Dahlia asked, you may have already covered this, and I apologize if I missed it. She asked, where do they get your phone numbers from?
Yes, Angel, you want to mention that again?
Yeah, absolutely. It's all online. They just Google it. I mean, our phone numbers are online. So that's how these scammers are getting our numbers. Or also they'll buy it from different data sites. A lot of websites collect our data. Whenever we're shopping, we go on Amazon, we're using Facebook, all sorts of things like that. It is collecting our data and they do sell it to their partners. And that is something in one of those, terms and conditions where we just check the box and say we read it when we didn't. We're agreeing to having our data shared and sold, unfortunately. And so that's how all of our data is found.
All right, thank you. Another question is, how far back can you go with fraud to report it?
So you can report fraud at any time, right? There's no limitation on reporting fraud, but to actually have it appealed by Medicare, get that money reinstated to your Medicare, those benefits put back on, that is a different process. My understanding is that is 1 year that you have for appeals. And it also depends on the type of fraud. A lot of times, if you are defrauded, you are not going to get your money back, unfortunately. If you have been scammed, if your bank account has a lot of money withdrawn, et cetera, a lot of times that money is gone in the wind, and you're not able to get that back. So that is two different things, but there is no time limit for reporting fraud, and all of that information is very important and relevant.
Angel, isn't a lot of that based on the fact of how they got it? If you gave them your bank information, then you're going to be responsible. Now, if somebody just somehow taps into your bank and you didn't do anything, then there are fraud mechanisms that get your money back. Isn't that correct?
Yes, absolutely. It's very dependent. And so that's why we want to be super careful with our financial information. Because at a certain point we are held liable at sharing, if someone calls and they ask for a Medicare number and we give it to them and then they defraud us of so much money. I mean, we did consent to giving them our information. So it gets very, very complicated, but that's a really good point, Marty. Thank you for pointing that out.
All right, the next question. Why am I getting Medicare advertisement in the mail? I am way too young and I'm fully employed. Tracy, I totally understand. I get Medicare advertisement in the mail, but I did have someone living here at one time who was over 65 and on Medicare. Sometimes the lists are sold to people, and it could be a combination of younger and older people. And so those lists are out there, and they think maybe everybody's on Medicare. So it's really hard to say why you're receiving those advertisements, but feel free to share it with people, but let them know it's an advertisement. It's not Medicare, and you can toss them because it's not necessarily helpful.
And also it may go back to that data tracking that happens. I mean, if you are attending webinars like this, if you're Googling things that involve Medicare fraud or Medicare policies, these websites are tracking it. So some data system may have you as a 70-year-old retired man, whatever. That's just the content that you're consuming. So that may be responsible as well, Tracy.
And some of that can be voice. They can get it through your voice too. Because I can't tell you how many times I've been sitting to talk to somebody about something, and next thing you know, I get advertisements for it pop up on my phone. I mean, they're getting you from every which way.
Right.
Yes,
or
100%.
if you're searching the internet for somebody else.
That's right.
That's another way they can get information.
Yeah.
If you're looking up something for somebody, they may tag your email because you're going to a specific website, or not even a specific website. Sometimes I'll search for stuff. Next thing I know, I'm getting ads. So, it's hard to say how they're getting that information. All right. Faye says, thank you, Angel. So if the call goes to voicemail, the scam call, do they still consider it an active phone or only if I pick up?
Oh, typically only if you pick up. There's softwares, if you are getting sent to voicemail, that could be because, the phone line is still active, but the user's passed away, or they've changed phone numbers and they just haven't given up on the plan, et cetera, et cetera. And so voicemails are typically fine. And that's what we encourage you to do, is have it just sent to voicemail. And typically only whenever you answer and start playing along, that's whenever they mark it as a live line.
Thank you. And yes, we will be sharing the PowerPoints. It's all one PowerPoint, so everyone will get that. And we appreciate the questions and the encouragement from everyone. That's all the questions that I see in the chat. There are, let's see, in Q&A, can you talk about the form the providers can have you sign before services that say if Medicare doesn't pay, are you responsible? Felicia, you want to take a stab at that one?
You're
Unmute,
on mute,
please.
Felicia. Felicia, you got to unmute. There you go.
There we go.
There you go. Nice.
Can you talk about the form the providers can have you sign before the services
Yeah,
that say
that
that Medicare?
basically they get you to agree.
They do,
be
yes,
responsible.
and won't give you copies of it at the time you're signing that little pad. You can request that they email that to you by providing your email number, email address, and but if you are signing those documents, and I know I have at the doctor's office, I'm just signing away because it's just rolling down that little script and you just click it and sign. But yes, I have asked for them to email all the documents that I've signed. And it is, it's kind of concerning because you just don't know because they have you signing it.
Mm-hmm. I'm trying to think of the exact name of the form.
It's authorization form
or financial responsibility form.
Oh gosh, I just lost it. Where they
but if
say
you don't sign
Medicare
the form,
may not pay.
Right, and that's pretty standard. But again, go back to your Medicare summary notice, and you will see your share and what the portion the doctors are charging. And if they do bill you, send that to them. That you don't owe a portion because your share would be zero.
Judith added, but if you don't sign the form, are you still responsible?
In some cases, I don't think so. I know.
Yes. I'm sorry. Go ahead.
I know I have signed those when my sister was ill, but I would always sign, I am not responsible for this bill because I'm giving them permission to treat her in the emergency room. But I put on there, I'm not responsible for this bill.
Yeah, that's good to put that on there. Some doctors may say you're responsible and some may not, but it's called the Advanced Beneficiary Notice of Non-Coverage. That's ABN. That's
ABN.
what it's called.
I could not think of that.
and I know I couldn't either. And they can provide that if they think Medicare will not cover the service that you're getting. So you can check with the doctor even before you go in for some type of service. You can ask them, if they feel that visit will be covered, and then ask, do they use the advanced beneficiary notice? So that way you know up front if they're going to provide that to you. So that is based on the provider as far as whether they provide that.
Okay, well, we're 20 minutes past. So I want to make sure I thank you all, Melinda, Felicia, Angel, thank you so very much. Thank you. Thank you. You can see all the compliments in the chat. We certainly appreciate it. Great
Yeah.
stuff. Please look out for the survey to fill out. We ask everyone to fill it out, even if you're not looking for CEUs or certificate of attendance, but you have to do it if you want one of those. But thank you all for joining us, and we all hope you all have a wonderful scam-free day. Take care.
Thank you, Marty. And the
Bye-bye.
phone numbers are all in the PowerPoint. All right.
Right.
Have a good one, everyone. Bye-bye.
Thank
Bye,
you.
y'all. Thank you.
Bye-bye.
Bye.